Food is the engine that drives humanity. But do we know how the food we partake of was grown? Healthy diets prevent illness, but poor diets can cause serious problems. In fact, poor diet is the second leading risk factor for death and disability worldwide. How the food we eat was grown also defines this diet. People around the world and here in Kenya could be eating toxic pesticides that have become a part of their diet. Many pesticides are proven to cause many diseases including cancers, breathing problems, infertility, and even brain damage in children. There is hope. Kenyan MPs are considering withdrawing the most toxic pesticides from the country. It is for these reasons that the Standard Group and our partner Root to Food bring you a special forum on toxic business. Join a team of experts this Friday, 31st July at 7:30 p.m. on KTN News and Farmers TV. And together, let's safeguard our future.
Have you ever bothered to ask what kind of pesticides are used in that food that eventually gets to your table? Did you ever imagine that some of the diseases we end up getting could be linked to this? Sit tight as we engage in a robust discussion on Transform Kenya with our distinguished panelists joining us from multiple locations. Transform Kenya is a Standard Media Group initiative to champion for social impact in the society. To be part of this conversation, join us on our various social media platforms, and we can also catch this discussion on our sister station, that is Farmers TV. Our hashtag for this conversation is hashtag Transform Kenya SG and Toxic Business. Now, our panelists will be able to join us in a short while. And let me begin by introducing our first panelist for this very important discussion. We have Dr. David Amudavi. He is the Executive Director of the BioVision Africa Trust, a not-for-profit organization based in the International Center of Insect Physiology and Ecology, ICIPE, here in Nairobi. The Trust's goal is to alleviate poverty and improve the livelihoods of smallholder farmers in Kenya and other African countries through dissemination of information and knowledge on technologies and practices to improve human, animal, plant, and environmental health. He oversees a comprehensive farmer communication program consisting of Web Infonet, web-based knowledge platform. Dr. David also coordinates the African Union-led Ecological Organic Agriculture initiative implemented in several African countries and the Knowledge Center on Organic Agriculture for Eastern Africa. On to our second guest for this conversation, we have Leila Libertro, is the project lead of the Food to Root initiative in Nairobi. Her work in Kenya involves advocating for agricultural development policies that support sustainable food systems and food sovereignty, as well as to use creative communication and political engagement to address the accountability of public authorities to the right to food. Through the initiative, Leila works closely with small-scale farmers, like-minded grassroots organizations, the media, policymakers, and the wider public to foster a socially inclusive, cross-sectoral discourse on chronic food insecurity and food rights in Kenya. Our third guest, we have Madam Alice Kemunto, the Executive Director for Consumer Grassroots Association. She is also the Secretary of the Association of Civil Society and Private Sector Alliance in Africa. For the past 15 years, Alice has been a frontliner in advocating for the right to safe food in Kenya, especially at the grassroots level. She has also been championing climate change issues caused by food systems and empowering women to be ambassadors, right to food at the grassroots level. Last but not least, we are honored to be having Dr. Catherine Kunyanga, who is a senior lecturer in the Department of Food Science, Nutrition and Technology and the coordinator of the Food Security Center at the University of Nairobi. She has published several papers in international journals on various subjects in food science and nutrition, as well as attended workshops and conferences, both locally and internationally. Her research is still ongoing and contributes towards use of healthy foods in a holistic and interdisciplinary approach to promote consumption of the safe foods. Dr. Kunyanga is also engaged in training various food industry and sector, including startups, SMEs, women groups, with the aim of empowering them socially and economically through different product technologies. She has worked in different capacities as a researcher, project coordinator, and consultant with different stakeholders in private-public partnerships, NGOs, local communities, governments, and international collaborators through active networking. Well, that's a look at our panelists for this very important conversation, and I'll be your moderator, Abby Agina. Just before we kick off the conversation, we'd like to set the stage with a very interesting report. Scientists are now stating that there is a direct connection between misapplication of nitrogen-based fertilizers, cancer, and child mortality. They spoke on the sidelines of the nitrogen conference at UNEP headquarters a while back here in Nairobi. Mark Namaswa has more.
As farmers across Kenya till their land and plant as they have done for decades, scientists say they might be endangering their health through improper tilling and fertilizer application.
In areas where people consume contaminated drinking water with a lot of nitrates in it, and if such drinking water is given to very young infants, it can be fatal.
Scientists also say a combination of leaching, nitrogen-based fertilizers and pesticides can transform into a lethal cancer-causing mix if humans, mostly in agricultural zones, and their water sources are exposed to this.
Cancer is one of the risks associated with too many of these things becoming a part of our food chain. So that's a daily reality for a lot of people.
Lakes such as Naivasha and Victoria are cited as those currently reeling from effects of agricultural waste runoff from areas up in the hills.
That fertilizer, part of it can be converted to the air, and that will be very dangerous because if it's converted to the nitrous oxide, because the impact of that to the ozone air is 3 times the impact of carbon dioxide.
Farmers have been advised to till and apply fertilizer appropriately to avoid cases of the fertilizer ending up in water bodies. Mark Namaswa, KTN News.
All right, that report, of course, sets the scene for us, and I'd like to start off with my first panelist, Leila from Roots to Food. Pleasure having you on the program. I just want to get your sense of where are we as a country when it comes to the use of pesticides? Are we using the right pesticides? Are we using the right dosage? And where do we head as a country when it comes to ensuring that we're able to manage the level of toxins?
Thank you, Abby, for having me this evening and having us and hosting the show. We published research last year which has showed that many of the pesticides registered for use in Kenya have harmful effects to humans and to the environment. And so there are some great concerns around what is being used in the country. And there is a petition, this paper informed a petition in Parliament submitted by the Root to Food, Kenya Organic Agriculture Network, the Biodiversity and Biosafety Association of Kenya, and Resources Orientated Development Initiatives, and through the Honourable Gladys Bosch-Cholet. And the petition is really calling for the withdrawal of toxic pesticides in Kenya. And so this is the direction we're hoping to go in the future.
All right. I'll be coming back to you. Let me bring in Alice Kemunto, who would also just want to get your sense of interpretation of, do we have the right legal framework in the country to safeguard consumers?
Happy, there's something I've not heard. Can you repeat it again, please?
All right, just off the remarks made by Leila, I just want to get your interpretation when it comes to our legal framework as a country, when we look at the current laws governing consumer rights, because it's one thing for people to go and buy food, and it's another thing for them to know what are some of the dangers that are associated when we talk about toxins in food.
Thank you, Abby, for this opportunity for us to talk to the country and especially consumers of this country. It's true that we have more than enough laws, I can say, on consumer protection. But then the laws that have been established, the laws that have been passed, they are really not sufficient enough to protect consumers, especially when it comes to food production. Though those that are there, even those that are there, they are not utilized well. The legal framework in Kenya is quite fragmented. So many ministries are involved in food security. There are so many departments involved in food security, in food safety. And at the same time, there are some loopholes in our legal framework that are allowing unscrupulous business people to sell pesticides in this country that have components that are not good for human consumption. So yes, we have some legal framework, yes, we have it, but then the enforcement bit of it also is quite shaky, that we don't have proper mechanism to be able to enforce these laws to benefit the consumer of this country.
Thank you. And to you, Dr. David Amudavi, I'm just curious to find out, we've been talking of this big term, toxins. Just break it down for us. And looking at most governments in Africa, including Kenya, they've been advocating for conventional farming as a way to increase food security and also to form employment. Just walk us through what are some of the key issues right now when we look at the toxicity in food.
Thank you, Abby, for having me on this panel, and again to have another opportunity to talk to the Kenyans over this important issue. I'm glad it is a very timely issue because it's again one of those big four agenda aspects of our government, and that is ensuring that we have food that is sufficient, secure, and available for everyone. And to get food, it means we ought to put in resources that are required for the production of that food. And you asked earlier the question of whether people are aware of what they eat, but also whether people ever ask, how is the food they eat produced? And that is where we come in and look at the question of what is being put in terms of inputs, and especially chemical inputs in the production of the crops that provide the food that we eat. And as my colleagues have said, and work has been done not only in this country, in several African countries and even European countries, it is true that when food is produced largely from chemical synthetic pesticides and other inputs like fertilizers, then we are likely to find that such kind of food may not be as healthy and safe as it should be. So one of the things that we are looking at is how do we ensure that there is food security, there is enough food for everyone at all times, but at the same time the food is healthy for the population. Because if we don't have healthy food products consumed by people, then we are likely to see some of the cases that have already started happening with the non-communicable diseases and are being alluded to the food that people are eating. Sometimes you can also see some of the food that people buy, sukuma wiki, for example, spinach, and as they say, all that glitters is not gold. How is that food produced? What kind of inputs have been produced? And Abby, I want to say this. This is one question that not many people do ask when they eat food, and especially the food that they buy. And increasing cases of health somehow are related to the kind of food that we eat. Today, as we speak, everyone is very much concerned about COVID-19. And as much as we are concerned, we are also looking at how do we get it treated. And I'm sure the first country that comes up with an appropriate vaccine will really help a lot to save the lives of people globally. That is the same thing with the food that we are eating. the effects that are in the food that we eat that has toxins, that has chemicals beyond what is reasonable, are likely to have effects on our health that could be seen in the long term very heavily. And this is likely to have a very serious impact, not only on our health system, but also on our economic system. So we have the question to ask ourselves: how do we produce food in the most safest possible way and in a very sustainable manner? What kind of inputs, alternatives do we have to the current provisions of chemical-based pesticides and fertilizers?
Thank you, Dr. Ari. Let me bring in Dr. Catherine Kunyanga. When you hear the very sobering comments being made by Dr. Mudavi, should Kenyans be concerned about pesticides in food?
Thank you, Abi. Yes, actually, the public and citizens of Kenya need to be worried and concerned. Our experiences as a university and as academia have shown misuse, overuse, and also misuse, overuse, and abuse of certain chemicals that are not even regulated, and with the active ingredients that would cause what he has described as toxicity. So there is evidence, yes, due to lack of sensitization and awareness, our farmers or producers are actually using a lot of pesticides without knowledge or even education on how they should be used in our foods. And this ends up in our food value chain and has caused a lot of issues. And he has mentioned non-communicable diseases, things like cancers now are on the rise. And this is basically based on what we eat. We are what we eat, so basically if you consume chemical residues in your food, then it means you are putting your health at risk. And not only are we concerned about human health, but we are talking of also animal health, we are talking of the plant health itself, and also environmental safety. So there are so many aspects around this. So as much as, human health is also foremost, I mean, the health of the Kenyan consumer comes first, but also we have other aspects that we need to be worried about. And as you've shown in the previous clips, our systems, our water are all contaminated with chemical residues, which end up from what farmers are using or producers are using on the food. So yeah, there's a reason to, or cause to worry, and a lot of toxicity studies and epidemiological studies have actually shown that these chemicals can cause serious harmful effects on consumer health. So yes, as Kenyans, we need to be worried. We need to know what is coming into our country, what's being used in our production system, our food system. We really have concern to worry, and I'm glad that this white paper is coming into consideration, and the government is taking this seriously, and as well as the public. So we hope through this discussion, Kenyans can take this issue seriously. Thank you.
Thank you. Let me bring it back to Madam Leila. When we look at where we've come from as a country, and of course the major issues around pesticide use, walk us through, what does this petition seek to achieve? Will it marshal the right numbers for it to actually sail and become a legal aspect of our country?
Harmful active ingredients. And it's important to note that it's not a call for a blanket ban of all pesticides. We are expecting a review of the pesticides registered based on their application in a Kenyan, so not a European or American context. So I can give you an example. A lot of when a pesticide is registered in Kenya, the maximum residue levels that are looked at are based on standards and data collection done in a European or American or another context. But we know that, for example, the diet of Kenyans eat more maize. And so the maximum residue levels that are permissible or allowed for maize in, for example, Europe would be different to what they are in Kenya. We also expect to see, or the petition also calls for improved food safety monitoring and data collection systems. So KEFIS, KEBS, NEMA need funding and staffing capacity from the government to fulfill their mandates here. And this function shouldn't depend on donor funds. And data collection is really important to raise. What baseline are we working from here? And we have two doctores on the call, and so they will know that this is an important. This is important to have data, because at the moment there isn't any, and we don't know what the effects of these pesticides are on human health or the environment because of a gross lack of data.
All right. You've raised very pertinent issues, and I'd like us to pause for a moment because we want to go on a quick commercial break, and when we come back we'll be taking the conversation forward. Remember, to be part of this discussion you can join us on slido.com, and remember our event code is Transform Kenya. You can also follow this conversation on Twitter at KTN News KE, or you can tweet me at Agina Abi. Our hashtag for this conversation is Toxic Business and Transform Kenya SG. We'll be back after this quick break.
Kenya. Empower our nation. This is KTN News.
I help women find independence by training them